when we lose a tooth, there's going to be a space, of course. And before we go on and remove that tooth, we always give the options to the patients what is he going to expect to have in that missing teeth. Of course, doing nothing is an option, okay, like having a space. But those days, people wants to have something in there. So the other options that, apart from implants, that can be put is either a bridge, a partial denture, or a removable plate. Now, they're all options and they've been used for quite a long time. But in reality, the difference between an implant and the other is simple. The implants is a freestanding tooth sitting in there without really touching the neighboring teeth. Now, when we do a bridge, basically we're going to cut two sounds teeth or teeth that they have fillings, and of course we have to assess them as well, see the suitability for a bridge in there. But in reality, we are cutting two sound teeth to put one in the middle. Along the track, those teeth, if the oral hygiene is not really kept that well, they might have decays or problems or whatever. The cleaning is going to be a bit difficult because in reality it's going to be something soldered in there. So the long-term success of a bridge, it's not really that long if you compare it to an implant. And the reason for that mostly is the difficulty in cleaning that area. So the bridges are becoming a little bit old-fashioned, but again, it's an option. The other option is a removable appliances. Now, removable appliances, it's there and it's been used for years. But in reality, not every person would like to have something that, that is movable. And also there's the question of cleaning, and having a removable thing, in my opinion, is becoming a bit old-fashioned, but still people, they use it. But again, when you think about having something removable in your mouth, especially when you're eating or talking or whatever, people prefer to have a fixed thing in their mouth. If it was myself or a friend of mine, I would offer them a more fixed thing. So that's why the implant is becoming the standard or the state of art of putting something nowadays. And the other options are there. I mean, ranging from doing nothing or putting a plate or a bridge, but I believe the implant is the standard now, and those other options are their options. But people should think about implants, and that's the way to go in the future.